I mean, is there something in the water, or is it just me? Which brings us to marketing. This guy's periodontist, Reno or Las Vegas, Nevada, graduate of Harvard. Now, I'm a graduate of Georgetown. We think Harvard sucks. But I just went to graduate school at Georgetown, so I really shouldn't say that. He then went to Northwestern, which is a good school when it was still existent, and he is now a laser periodontist. And the thing that intrigues me is that he does microscopic laser surgery. Now, what the hell is that? That's a new one on me, but it sounds good. It makes it sound like you're down there cutting desmosomes in half. And this is old, but it kind of sums up my attitude. It's about the profit. It's about how to make money with these things, and that is really what promotes them. And then we have the American Academy of General Dentistry teaching hygienists how to use lasers, because the hygiene department is a cash cow for your practice. And the more they can do to rake in more money, the more money you're going to make. Because you never give them a raise, according to my wife. That's how you make more money. What in the hell is going on here? And then we're back to that little advertisement, and one of my own people sold us out, Seb Ciancio, periodontist. Now, I don't know, he's published one paper in this advertisement on lasers and never touched a laser since. He got paid some bucks for this. That's the only way he would have done it. Less pain, less bleeding, less swelling, less tissue removal. You know what? All that's true. Every last statement there at the top is true. This was from a newspaper article in Albuquerque, New Mexico. Now, Charles Gallagher, I happen to know. He's a general dentist down there. He's appeared opposite me as an expert witness on at least 3 different cases, and I've won every one of them. And it's because he selected these patients poorly. He selected these clients poorly. It was no hope case, all 3 of them. But look at this. Laser-assisted therapy also is intended to stimulate bone growth. Now you know which laser it is. It's the ND-YAG. The energy of the laser penetrates several millimeters into the bone, killing bacteria that inhibits bone growth. Now, I hope that's not the case. I hope we're not penetrating bone with laser energy to kill bacteria. That sentence has a little bit of a syntax problem, maybe. Or maybe he just doesn't know what he's talking about. I don't know. But it implies that the bacteria are in the bone or on the bone, and they're being killed by the laser energy penetrating the bone. 1 in 3 dentists in Albuquerque and 4 in New Mexico who practices laser-assisted periodontal therapy. The equipment costs $40,000. That's not true. The equipment costs $70,000. The course costs $3,000, so the total package is somewhere a little above $70,000. And the additional training is $24,000. Now, why would he say that? I don't know, except that it makes him look good in that he paid out a lot of money to go get trained on this. But that's not how much it costs. And if it is, then it's changed. I'm not aware of it. Maybe it does. I'm not aware of it. The patient, Becca, said that some of her teeth were scaled, but stronger treatments were required. My teeth were starting to move around. Now, that's pretty severe disease when you got tooth migration. That's probably terminal in my mind. In severe cases, periodontists use a surgical technique that involves peeling back the gums to remove tartar, then suturing the gums so they fit tightly against the teeth. I love the choice of words, peeling. It's a difficult procedure. It takes an hour just to sew up the gums using a complicated suture technique. What in the hell has he been smoking? What in the hell has he been smoking? If I spend more than about 10 minutes suturing up a quadrant of flaps, that's a long time, and it's sure as hell a monkey with a broken Coke bottle can do it. There's nothing complicated about it at all. And then he goes on to say that 80% of the cost for laser-assisted therapy is covered by insurance plans, and it costs anywhere from $400 to $1,200 per quadrant. We got a little insurance problem going on here because there is no code number, no CD code number for laser therapy. So they're forced, if you're going to collect that kind of money off the insurance, and most policies only pay $1,500 a year max, so after one quadrant of $1,200, you pretty well chewed it up. The other three quadrants end up being on the patients. That's a little bit of a misleading statement, but by saying that, that implies to me that he's coding this for something other than laser-assisted curettage. It's being coded for gingival flap or osseous surgery, neither one of which it is. There's no flap being laid. Laser makes dental surgeries quicker and less traumatic. New gum disease treatment reduces pain, chance for infection, expert says. He doesn't have severe gum disease, but he's got enough bleeding and infection that we're concerned. We don't know how much to be concerned, but it's all going into the blood. That's a real intelligent statement. The neat thing about a laser is that it's a video game. It only kills the bad guys. I guess it leaves all the other bugs there to be viable. While laser treatment is not new, this particular procedure is the only one that's FDA approved. Well, the procedure is not approved for therapy. It's a 510K approval by the FDA. It's an equivalency approval saying that this laser is, the way it's being used, is equal to other lasers already on the market. So that's not true either. Though it also will touch on the mouth's healthy bacteria, well, what happens to the bad guys down here? Those and any unaffected gum tissue are not affected. In other words, it only removes the bad stuff and leaves the good stuff behind. It makes the healthier bacteria healthier. Can you believe this nonsense? It makes the healthier bacteria healthier. How does it do that? The procedure previously would have required invasive surgery, cutting the gums back, cutting them out before cleaning and treating them with days, cleaning and treating, then days of recovery, antibiotics, pain medications, swelling, bleeding, bed rest, prostration in the hospital ER, I don't know. I'm not going to go on. It's just one asinine statement after another in some of these articles. And you just have to wonder where they're coming up with this. This is out of Springfield, Missouri. This is an advertisement. You've seen those before, haven't you? You've seen that in the Millennium Laser advertisement. Well, a lot of this they get from Millennium, I think, at their course, because it all sounds alike. Notice, have recently completed intensive training in laser periodontal therapy. We are pleased to announce laser therapy, intensive therapy. There are no incisions, scalpel, no sutures, and you heal naturally with preservation of your gums. Laser periodontal treatment is an advanced technique for your doctor to treat periodontal disease and save many teeth that were previously considered hopeless. That may or may not be true. What this means to you, the patient, is dramatically less traumatic. No cutting of the gums, no sutures, minimal bleeding. Preserves gum tissue instead of cutting it away. Reduces root exposure and sensitivity. Reduces infection. Reasonable expense. Well, that's in the eye of the beholder, I bet. Breakthrough laser treatments. Remember that? 2002, 1996. 1996, 2002, breakthrough new standard of care.